My name is Dr. Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Recently, I had the pleasure of spending some time with my friend Heather and her two children, Josh and Addie. And what I really wanted to do, and maybe I'll get it done eventually, is to have Josh and Addie do a little dental video on how they brush their teeth, so how two children brush their teeth. And I thought that would be a really great thing for you to see and to share with your children. But it also got me to thinking about sealants, dental sealants. It's something that dentists tend to take a little bit for granted, and we bring it up to our patients on a need-by-need basis. But I thought I would talk to you about dental sealants. What exactly are dental sealants? You do hear about them, and most people just have kind of a vague idea as to what dental sealants are. What they are is a very thin, very thin coating of plastic that's applied to the chewing surface of molar teeth. The surface of the teeth that has all the irregularities in it, the pits and fissures and grooves that are attracted by bacteria. Bacteria is attracted to those pits and fissures, kind of set up housekeeping in those grooves, and can cause cavities. So the thinking is that if you create less surface area, fill in those grooves and fissures and pits on the chewing surface of the molars with in a very clean procedure with a plastic that's compatible with the tooth, that you're going to have less likelihood of that tooth to develop decay or a cavity. And it's a very effective means. Here are some of the really great things about sealants. They're painless. There's nothing painful about having a sealant placed. It's very quick, it's very efficient, and it's non-invasive. You don't drill into the tooth, and because you're not drilling into the tooth, you don't need to have anesthetic, so there's no injections necessary for a sealant. Typically, the best time to have sealants placed are relatively soon after the tooth has erupted. So the first permanent molar that erupts in a child's mouth happens around the time that they're 6 years old. The second permanent molar that erupts in a child's mouth happens around the time that they're 11 or 12 years old. So in that time frame, having the sealants placed on the molars, if that is something that your dentist and you have agreed is important to have done, that's the best time to have those sealants placed. Again, they're painless, it's quick, it's efficient. There's not really any sensation to the child after the sealants are placed other than it feeling maybe different for a day or two. But there's not enough material placed that it will change their bite or alter how they chew. It's all very useful. So sealants have, and they come usually, they're clear. The way that you will get them are either that they're clear or they're slightly opaque. That makes it a little bit easier for your dentist, your current dentist, or if you have a different dentist, you change dentist, it's easier for them to see where the location of the sealant is. And most sealants last anywhere from 5 to more years, 5, 6, 7 years. And it's very important, just like with any dental procedure, it's very important for you to maintain those twice yearly dental visits so that the dentist can assess to make sure the sealant is in place and that it's still sealing the tooth properly. It's very important. What I meant by a case-to-case, case-by-case situation is your dentist and you are the best determinants as to whether or not you or your child should in fact have a sealant. So my intention here was just to give you some information as to what a sealant is and what to expect with sealants. It is, however, the decision that you and your dentist together will make as to whether or not you or your child would benefit from sealants. Each dentist has different philosophies about sealants, and the parent or the patient themselves needs to be well informed and make the decision about putting sealants in themselves. So I hope that's been helpful, and I am really determined to get Josh and Addie to do a video for us to show us about taking good care of their teeth when you're a child, brushing their teeth. So that's a shout out to you, Josh and Addie. And thank you again for listening. And if you have any questions, always remember you can email us at info@parkridgedds.com. And remember, as always, we love making you smile.